What policy and environmental changes to reduce chronic disease or improve healthy behaviors have you been successful in achieving? At Columbus Public Health, the Healthy Places program has been very successful at using policy systems and environmental change to reduce chronic disease in our community. One of the things that we've been successful in doing is a policy intervention in our city's rezoning review process, where we've hired an urban planner to come in and work within the health department to intervene with developers and ask and request that they increase active living features and things that promote the use of physical activity in daily life among our public. This has been so successful that over the last 5 years, 55% of all private developers have actually voluntarily accepted comments and recommendations that our health department has made to strengthen their projects. Do you have a method to address health equity or health inequities within your chronic programs? If so, what? If not, why? Columbus Public Health has been addressing the issues of health inequity in our communities in a variety of ways for several years. One of the things that we're doing relatively recently is we've actually reorganized as a health department and created a brand new department of health equity so that we're able to link all of our services, from clinical services to chronic disease prevention strategies to other services that help people gain access to needed things to improve their health when they come to visit us at the health department. Columbus Public Health has gotten a lot of value out of actively participating as a member of NACCHO, from the wonderful meetings that they've organized to encourage mentorship among large cities, to the toolkits and information that they make available to local health departments on their website. They're making a real difference, I think, in terms of advancing the practice of public health and in changing policy to make everyone in our country healthier.
Okay, good morning. My name is Karen Weller. I am with the Miami-Dade County Health Department. I am the Director of the Office of Community Health and Planning. And I would like to mention and share with you several of the things that we are doing at our health department to influence policy and environmental changes. Through our Consortium for a Healthier Miami-Dade, we have been able to work on several policies and environmental changes. One of the areas that we worked on was our child care task force. We were able to put together policies that help decrease screen time with children, have been able to help us to get good nutrition, have menu changes. We've been able to work with the child care centers to be able to get the menu changes. We've also been able to work with our public school system, where they've been doing wonderful work in getting farms to schools, to be able to work with them, to be able to put in what we call reimbursable vending machines, where they're able to have vending machines that sell healthy foods that are prepared by chefs, so that the students are able to eat healthier sandwiches and salads that are helpful. The other thing that we have been able to do is we've been able to work in our county with our Parks and Recreation Department, and through our Parks and Recreation Department, they've been able to put healthy vending machines throughout most of the parks in Miami-Dade County. They've also been able to update their urban design manuals so that those manuals will have the principles of active living in them. In addition, with the different municipalities in our county, we were able to get more wayfinding signs put up, more bicycle racks, and we've been able to encourage more active living. The other area that we have been very successful is working to bring fresh fruits and vegetables to the areas in the county that we consider to call food deserts, because they do not have supermarkets within 1 mile of certain areas. And so through our farmers market initiative, we've been able to bring farmers markets to areas with the most health inequities and disparities. And so that's been something that we have been very successful in being able to implement.
Hi, I'm Jim Krieger, and I'm Chief of the Chronic Disease and Injury Prevention Section at Public Health in Seattle and King County. And I've had the privilege of being able to attend the NACCHO's Big Cities Community of Practice for Chronic Disease Prevention. and wanted to share with you some of what I learned and also some of the accomplishments that we've been able to bring and share with other local health departments by being at this conference. We've been able to do a lot in the last couple of years in Seattle and King County, primarily because we've had great staff, great elected leadership, and also CPPW funding. Some of the things that we've accomplished have included having more than 14,000 units of public housing become smoke-free so that residents, and particularly children there, are not exposed to the harmful effects of secondhand tobacco smoke. We've also created 22 smoke-free parks, and this continues to be a movement across the county, so again reducing people's exposures to secondhand smoke. We've done a lot of work around increasing awareness of the health effects associated with consumption of sugary drinks and made this into a visible issue in our communities, with more than 1,000 people taking the pledge to kick the habit of drinking soda at least one day a week, and many institutions beginning to stop or curtail the sales of sugar-sweetened beverages on their premises. We've been able to work closely with local planning departments and planners, and through this work with them have had several jurisdictions, and probably more than a dozen, adopt either comprehensive plans that include more sidewalks and bike trails, or actually adopt bike and pedestrian master plans, thus making it easier for people to be physically active in their own communities. In order to increase access to healthy foods, we've been able to support more than 40 healthy corner stores to be developed, and these stores are all now selling fresh produce, fruits and vegetables, in communities that had limited access to affordable produce in the past, so people can make the choice to eat healthier more easily. Another really rewarding experience has been working with our faith-based communities, and so, for example, 6 African American churches in Seattle have now gotten rid of their vending machines, serve no soda or other sugary drinks at their church functions and their child care programs and after-school programs, and are also now developing physical activity policies as well to get the congregation moving more. So through all of this work, we've applied a health equity lens to make sure that these activities are happening with the people and the communities that are most affected by health inequities. So, for example, more than 90% of our funds and staff time are going to communities identified through our public health surveillance systems as having the highest rates of obesity, the highest rates of poverty, the highest rates of tobacco use. And so by targeting this, we hope to decrease the gaps between the more privileged people in King County and those who are more affected by these adverse health outcomes. And the community of practice is going to be really helpful for us in moving forward this work. Through the community of practice, I can very easily find other colleagues across the nation now who are doing similar work or have done stuff that we're thinking of doing in the future, and pick their brains, get the best ideas they've had, get some pointers on how to do it more effectively, and learn from the lessons that they've learned in doing this work. I also recognize that being at the local level, much of what happens in our community is affected by national policy. And the big city's community of practice gives me a way now to work with my fellow public health officials across the nation to help shape those federal level policies and national policies to support the work we're doing at the local level to make our communities healthier places. I'm really happy that NACCHO's been able to be a great partner in this and making this work move forward by providing excellent staff support and technical assistance. And I think the future after this meeting looks really bright for all the big cities in the nation to band together to do the work it takes to make our communities healthier and prevent chronic disease.